Hello. We're here to share about our project that we did through the Age-Friendly Grant. And the title of the project was Revealing and Reducing Invisible Boundaries, Conducting an Equity Audit of Access and Inclusion to Drexel Health, Wellness, and Recreation Programs for Older Adult Promise Neighborhood members.
Just a brief overview of the project. We wanted to examine existing health, wellness, and recreation programs that are offered to older adults who live within the boundaries of the West Philadelphia Promise neighborhood and look at the ability of these aging residents to access those programs, barriers to access, and then finally the capacity and content of Drexel's health, wellness, and recreation programs. And we did this through 4 guiding questions. And the first is, what existing programs are available at Drexel that focus on health, wellness, and recreation for older adult Promise neighborhood community members? The second guiding question is, what level of access and inclusivity do older adult Promise neighborhood community members have to Drexel's health, wellness, and recreation programs? The third question is, what barriers to accessing Drexel's health, wellness, and recreation programs exist for older adult Promise neighborhood community members? And the final question, in what ways can Drexel health, wellness, and recreation programs better meet the specific needs and diverse interests of older adult Promise neighborhood community members as it relates to inclusivity and access?
So just to share a little bit about our project team included a group of researchers that were all connected to this issue in some way and co-constructed the project together. So we had Stephanie Smith Budhai from the School of Education, who has a long history from living in West Philadelphia to studying civic engagement, partnerships, and connections between universities and communities. Cameron Kisoglous, who works in the School of Education as well, but particularly focuses on sports and recreation, and was interested in this issue from a campus point of view and in access to older adults in the community. Carrie Hutnick, who works at the Lindy Center for Civic Engagement, and who, as part of the Lindy Center's work, considers how we better center community needs and voices in the design and development of Drexel efforts and resource distribution. And Karena, who is our Escalante, who is our PhD student on the project and works in the school and is in the School of Education with a deep interest in other research that she does situated in West Philadelphia. And our project timeline went from began in January when the grant initiated and concluded in November when we examined the data and looked at our findings.
So just our overview of our project accomplishments. We were able to engage in conversations with both older adults and Drexel University staff. More specifically, we interviewed and conducted interviews with 6 staff members of Drexel Recreation and Wellness offices. We interviewed 8 older residents within the West Philadelphia Promise neighborhood, as well as 1 focus group with those same residents, which those interviews supports one of the main goals of this project and starting these initial conversations around issues of health and wellness for older adults in the surrounding Drexel community that may be able to be used in the future to inform more intentional programming for these older adults.
Right. And some of the initial findings, the themes that we saw emerge in a lot of the conversations with residents, both in the interviews and in the focus groups, included motivations for participating in programs. So a lot of that referred to nature of the program, their interest in the topic or the content, whether it included movement, whether it included some of the things that they were interested in doing, the level of difficulty, whether they felt like it was something they were able to participate in, the anticipated benefits of a particular program. So whether it was something for their physical health, whether they look to achieve physical health benefits or look to achieve learning new things as part of the program. Then their perceived actual benefits of some of those programs. A lot of residents reported the purpose of social engagement and connection, addressing feelings of isolation or addressing feelings of being able to have something to do during the day, or some worked around schedules of other things to do during the day, but enjoyed the consistency. Accessibility was an issue, making sure it was a time of day when people could go out, whether it was before it got dark or after people had to do other things in the morning. Some people preferred morning times because it allowed them to start their day, whether they could get to those programs, so whether transportation was provided or available, whether it was close to their location or far away, and then awareness of the program itself. So whether they were able to hear about it through word of mouth or outreach through existing networks, like people they know in the program or teachers who had taught previous programs or places where they had taken previous programs, and also communication, being able to have someone reach out to them and let them know about things that were going on.
Just to continue on with some initial findings from Drexel recreation staff, looking at community, they really see students, staff, faculty, and residents. Program awareness, we're at varying degrees, length of time at Drexel. Communication channels could be limited, primarily targeted to students and staff and not really initially at the community. Motivation to help, really grounded in interest in meeting needs, improving access, and looking forward. Community needs, some department needs more information, general to specific. University priorities, students first, access and tailored programs, and then resource allocation, limited funding, and then staff capacity.
So we identified some overlapping connection in these emerging themes, which we hope, again, like Stephanie said, encourages further conversation, further engagement, further participation by residents in some of the ways that Drexel programs are initiated. And so some of those overlaps that we saw were the motivation to engage. So it seemed like both people at Drexel, these recreational staff, wanted to offer things that were available and would engage older adults in the neighborhood. So there was that willingness to participate, and residents were interested in participating. And then also awareness. I think at both staff and residents saw the need for more understanding, more education, more communication, so that everyone is aware of what's available, but also that staff are available about what the needs and kind of potential barriers might be. And then accessibility, really trying to think about how do we align what's available with needs, setting university priorities. So when there's limited capacity, limited resources, how do we navigate those things to make sure things are available?
While we did have project accomplishments, we also faced some challenges in being able to meaningfully engage community members, namely space for growth and processes for community involvement. And this is due to lack of trust and technological barriers that were embedded within the quick pay system, some IRB challenges, and then staff and graduate student time and capacity, and a need for more aligned and resident research team members.
And our hopes for moving this conversation forward and continually engaging in increased access to health, wellness, and recreation programs, but also increased engagement in identifying needs and raising awareness and increasing access is through something. I think the Drexel University is currently working to develop programming at the West Philadelphia Community Center, working with community groups and engaging people in what should be offered and how and what kind of resources are available, making sure that dissemination of information is considered, building community and increasing connection with existing organizations. So maybe community organizations that provide these types of programs could partner with Drexel staff and Drexel programs. But also thinking about what, in aligning Drexel's role as an anchor institution, how do we think about this as an essential component to that mission as an anchor institution, and what pathways might exist for future relationship building, trust building, communication, constant feedback, and ongoing involvement. So thank you. We appreciate your time and appreciate you listening about our project.